Flu is gripping most of the United States. The Centers for Disease Control say 47 states are now reporting widespread flu activity. That's up from 41 last week. But the number of hard-hit states has dropped. Flu vaccines are recommended for everyone 6 months or older, and doctors say it is not too late to get vaccinated. And while the vaccine may not fully protect everyone, they say if you get the shot and still end up with the flu, the symptoms are usually milder. And the flu is, of course, taking a toll on the workforce. It typically costs employers almost $10.5 billion a year for hospital stays and doctor visits.
And nearly half of these 70 workers at a Clarksville car dealership, they've all been out sick at some point in the last month. Their boss said it didn't have to be that way if people had just stayed home in the first place and not spread the virus. 24-hour News 8's Dustin Grove is live downtown tonight with why for some employees, though, that is no easy decision. Dustin.
Karen, more than 1 million workers in Indiana have no paid sick time, and for them it's a difficult dilemma because staying home will cost them. Excuse me, guys. Ask around. Have any of you ever gone to work sick and contagious? And it won't take long to find someone who's reported for work contagious. For these guys.
Well, you know, you can't afford to take off a lot of times.
Did you have sick days, paid sick time?
No.
And they are far from alone. Roughly 40% of U.S. workers don't get paid if they're out sick. In Indiana, it's closer to 50%.
It's important for a variety of reasons.
Jessica Fraser represents the Indiana Community Action Association, an advocacy group for lower-income working families.
They're already struggling to make ends meet, so losing a day's wages is a big hit.
Today, Connecticut is the only state that requires some businesses to pay employees when they're out sick. Cities like San Francisco and Washington, D.C. have similar laws. In 2009, a bill was proposed in Indiana, but never made it out of the State House. Fraser says they're still studying the issue here.
We want to make sure that it's something that is going to work for the worker, for the state, and for the businesses.
Paid time or not, doctors say for your health and your coworkers, please stay home. And to keep from getting sick in the first place, they say there's still time for a flu shot.
The flu vaccines this year have been pretty effective at covering against the strain of flu that's circulating. Prevention is the key to anything.
Now, one concern when it comes to mandating some sort of paid time off is the cost to businesses, particularly smaller businesses. In a statement, the Indiana Chamber of Commerce said such costly consequences and mandates come with unintended and costly consequences and simply are not effective ways to deal with workplace issues. The statement went on to say, we are confident that individual employers will work with employees as best they can to accommodate their needs. And as we mentioned, flu shots are still available. For more information on where you can find one, check with your doctor, your pharmacy, or your local health department. Live downtown, Dustin Grove, 20